now because this is where I'm going to set up my sterile field, okay? But I want to allow it time to dry, okay? So I'm going to go ahead and wipe this down. I've already done my hand sanitizer. Okay. I'm just going to go ahead and get a biohazard bag out. Now you got to remember your patient is laying here, so you want to try to have a space for your biohazard bag where they're not laying. It can be next to them, it can be on the floor. You can have this out if you need to. Just remember that your patient's legs would be down here, okay? So I'm going to put it actually right here because the patient would be laying here. Okay, so what I'm going to do now is I'm going to put some gloves on and we're going to take a look at your wound, and there's mediums right here. So when you're taking off the dressing that is dirty, you just need to wear regular gloves, okay? So I'm going to go ahead and put some gloves on. And I'm going to go ahead and start by taking this top dressing off, okay? So I'm removing the top dressing, which is like a cover for the wound. And I'm going to be examining the gauze that I'm taking off, okay? I'm looking at the color of the drainage that is on the gauze, the consistency, if there's any odor, if there's an odor like a pungent, bad odor like infection, you would want to note that, okay? You'd want to look at, is it just kind of clear, bloody drainage, or is it green, yellow, brown? And you would document all of that, including how much drainage is on here, okay? And you would go ahead and toss that. Then I'm going to go ahead and remove the packing. With the packing, I'm going to be looking at the same things: the color, the amount, the consistency of the drainage, how much drainage there is, if there's dead tissue that has come off on the packing, like black or brown tissue, okay? Then I'm going to actually examine the wound itself, okay? So I'm going to be looking at the base of the wound bed it's called. Is it nice and beefy red, which is normal? That's normal tissue healing and growing in, okay? Because when you pack a wound, you're growing the wound, you're like healing the wound from the inside out. And so you want to see this nice beefy red tissue, which is like granulation tissue, that's healing tissue, new tissue forming, okay? If there's areas where there's black, brown, green, those could be indicators of, if it's black or brown, that the tissue is dead. And so you want to make sure you're looking for that and noting that if there is some. If there's areas that it looks like pus, green, yellow, thick drainage, then you would want to document that as well. That could be an indicator of infection, okay? You're going to want to look at the edges of the wound, okay? The edges of the wound here look kind of red. Now, it's normal to have a little bit of redness, but if that redness is spreading out into normal healthy tissue, that could be an indicator of infection as well, okay? You want to make sure that the edges of the wound, remember that picture that we looked at in lecture, how they were all white and waterlogged looking? You want to make sure that the edges of the wound aren't doing that further out into normal healthy tissue, because that means the wound is too wet, okay? Or fluid is seeping out onto the normal healthy tissue. And if it's wet for a long period of time, that can damage or make the tissue break away, okay? We're going to examine the edges of the wound kind of underneath here to see if there's what's called undermining. Undermining is where there's a lip of healthy tissue growing over the top, but underneath there's this like little shelf of where it's not healing in. And so the healthy tissue is kind of growing over top of the wound, okay? You also want to look for what's called tunneling. Tunneling is where in a certain area of the wound, there's actually a tunnel that goes into the tissue underneath, okay? And what you do with that is, or how you check for that, is you're going to be taking your sterile Q-tip here, and you can look for an area that is like going in. There's like a tunnel, okay? Sometimes when you press the tunneling a little bit, you will actually, it will break through and there's a further tunnel into the tissue even farther. And so you're looking for those little starts of those little tracks going into the tissue. That could be an indicator that there's an infection pocket, a pocket of infection in there, and that it's healing across the top, but there's a tunnel, okay? Sound good? So far, so good? Questions on any of that? Okay. The next thing you're going to do is you're going to measure the wound, okay? So for this, measuring, each office will have their own protocol or like how you measure, what instruments you have to measure. So what we're going to be doing is we're going to be measuring the length of the wound, the width of the wound, and how deep the wound is, okay? Now, if the wound is really abnormal shape, you could always indicate which areas of the wound using a clock, where those like areas of, where the wound goes way out further are. So at the top, facing the patient's head, think anatomical position, right? Up at the top would be 12 o'clock, 1 o'clock, 2 o'clock, 3 o'clock, 4, 5, and 6, 7, 8, and 9, 10, and 11, okay? So we're going to measure the wound from top to bottom, okay? And you would go ahead and measure it. Top to bottom would be your length. Over from side to side. And for the width here, you could say, well, the width at between 9 and 3 is this length, okay? Measure the width, and then you're going to measure the depth. Measuring the depth, use the Q-tip. You're going to place it into the wound, slide your finger down to where the edge of like the normal tissue is, and then you would take this and measure this, based on that, okay? Questions on measuring? Okay, so after we're done with this, these are typically disposable. You would dispose of them, or if in your office, like you have one for each patient, depending on if you work in wound care or not, if they're coming back, they might have their own instrument pack where you would clean it and keep it in there. We're going to go ahead and dispose of this, dispose of that. This all goes in the biohazard because it has blood or body fluids on it, right? I'm going to go ahead and take these dirty gloves off. Okay, taking them off, following your normal protocol here. These go in the biohazard. Now, I'm going to go ahead and wash my hands. For this test out, you can use hand sanitizer. In a normal real world setting, you may need to wash your hands soap and water because you've come in contact with blood or body fluids. But I'm going to go ahead and wash my hands. And then I'm going to tell Mr. Butts he can just relax for a few minutes. I'm going to go ahead and get some supplies set up to go ahead and clean his wound. I've already wiped down my tray, so that's ready to go. And I'm going to make sure I have all the supplies that I need here. Okay, I have sterile gloves. These cleansing swabs are just extra, so I'm going to put those over there. Extra gloves. Always bring extra supplies with you because if you set up your sterile field and then you need something else and you have to leave the room, what happens to that sterile field? You'd have to start over, right? We don't want to have to start over. So I have my sterile gloves. I have my cleansing solution that the doctor ordered, and we'll talk more about that in a minute. I have a drape, which will start my sterile field. That's how I start my sterile field. And then I have my dressing change tray. You will each get a dressing change tray, so you have your own to practice with, okay? So I'm going to start by going ahead and putting my drape on my table so I can actually create my sterile field, okay? Opening this, remember you don't want to reach over top of it. There's a certain way to open it, and it starts up here, okay? It peels apart. I'm going to lay this down once I kind of start opening this. You can go ahead and start peeling this apart a little. That way you don't have to try to rip so much. So peel it apart, only touching this 1 inch outside border, right? And then I'm going to go ahead and set it down. I like to put my fingers in the corner in that 1 inch border, okay? And then I peel back. When you peel back, you're just going to keep peeling back, okay? Now, if the edge rips like this and it's still touching that, you want to be careful. You probably need to get a new one, okay? So we're just going to continue on, knowing that I would get a new one. You'll notice this corner right here, if you guys want to come up and see, this corner is the top corner of my drape, okay? Do you see where the corner is? You open it in this fashion so the corner is closest to you so you don't have to reach over top of the drape. Yep. So I'm going to grab that corner. I can touch that corner because it's the outside 1 inch border, meaning it's not sterile, right? Okay. So I'm going to go ahead and grab this. Notice how I'm coming from this angle. I'm not coming this way, right? So I'm going to grab this top corner. I'm going to lift up and let it fall. It'll fall. Lift up. There we go. Okay. So I'm touching only the outside 1 inch border, right? Now I need to open this up. Notice when I lifted it up, it didn't fall down and touch the table, the packaging, anything, right? It just fell into thin air. So I'm going to go ahead and open this up. There we go. Okay, so I've only touched the outside 1-inch border. If that sticks like this, that's okay. When you start putting it on the table, it will open up, okay? So I need to put it on my table. Which way should I go? This way? Because what would happen here if I do this? Where's my arm gonna go? Over top of it, right? So I need to go this way. Now, when you go to put this on your table, be careful that you don't do this, because then what would happen? Unsterile. You got it. So you have to make sure that when you come here, you have enough space that you can go ahead and place it on the table. And notice how I'm backing up as I'm putting it on, okay? And then I go ahead and let go. I can adjust this touching the 1 inch outside border if I need to. I like to have it about like that, okay? So there is my sterile field. Now that I have my sterile field set up, can I do this? Because what would happen? Do I know what's going on with my sterile field? No. Anyone could touch it, put anything in it, etc., right? So I have my sterile field set up. I am going to pretend, basically, that my back is glued to this wall. That way, if I need to do something, I'm always facing it, okay? It has to be in your field of vision at all times, okay? So now what I'm going to do is going to open up my dressing change tray. I'm going to open in the same fashion that I opened up my drape, making sure that I'm not like this, right? I'm at this angle so I can see that. I'm going to go ahead and open it up. I need to open it up before I put sterile gloves on because is the outside of that packaging sterile? Like if I put sterile gloves on and then I did this, what am I touching? Something that's not sterile, right? And so I'm going to go ahead and open this up first, and then I'm going to kind of move it ahead. That way I can still have it in my field of vision. I have both of my sterile items in my view, right? And I'm going to go ahead and put my sterile gloves on. I've already done my hand hygiene, so my hands are good and clean. Remember, I can touch the outside of this. Folding that over. Making sure I'm not reaching over top. My shoes make me kind of tall, so I feel like I'm like hovering over top.
I felt at that table.
Yeah. Then I'm going to go ahead and open this up. Making sure that you have enough space to open this up without touching your drape over there or your sterile field up here. Okay, now I'm going to go ahead and put my sterile gloves on. Make sure my sleeves are out of the way. I don't have my watch on, so that's good. I'm going to go this one first. Okay, that one's on. Hold that one down. Hitchhiker thumb. Get my hand in there. Uh-oh. What happened? I think 2 fingers went in the same hole, right? Can I fix it now?
Yep.
I can fix it with this hand, right?
Yep.
I'm just going to go ahead and fix this real quick. Grabbing in the middle to fix that. I want to fix this one. I can pull out a little on this and then let go. Okay, my hands are sterile now, right? Okay, do I need to move that paper? Is it going to bother me right there at all? Nope, I'm just going to leave it. The more I touch things to move them, the more issues I could potentially have with contaminating my hands, right? Okay, so now I need to put some instruments on my sterile field that I might need, okay? So what I'm going to do is I'm going to reach into my sterile field. How far in can I reach? Can I reach in like this? Am I good there?
Yeah.
Is this sterile?
Yeah.
Is my hand over top of a sterile one? The part of my hand that's over top of it is sterile, right?
Yep.
So we're good there, right? What if I reach like this?
No.
Your wrist.
Too far, right? My wrist. So my hand is only sterile up to the edge where that cuff is, right? So if I reach in, I can only reach in, only the sterile part of my hand can be over top of that, right? Okay, so I'm going to go ahead and reach in. making sure that my hand does not come down and touch this outside part of the container, okay? Reach in, I'm gonna grab my instrument, and I'm gonna go ahead and place it on my sterile field. Now, 1 inch outside border, I can't touch that and I can't reach in past that, right? Was that good?
Mhm.
So far so good, right? I reached in, it only touched the sterile portion of the drape, my hand did not go past the sterile portion of the drape, right? Okay, next thing is a biohazard bag. We already have one set up, right? So do I need this one?
No.
Nope. Just drop it. Let it go. Next thing is a drape. I already have a drape, so I don't need this one. So I'm just going to let this drop that one too. Okay. Okay. Now I have some other additional supplies in here. I'm going to go ahead and reach in. Uh-oh. We'll talk about that in a second. So I have some gauze here. I'm going to go ahead and place on my sterile field, as well as some cleaning swab sticks. So I'm going to go ahead and place those on my sterile field. Okay. Trying to decide if it's over top of the glued area. So with that one, I would not use it just to be safe. Okay. You don't want to use something that has the potential to be contaminated. Is it is it touching anything that's not sterile? No, but just to be safe, I'm not going to use it. Okay. So I'm going to reach in, get that, drop it there. Okay. Next we have more forceps. Okay. We have tape. I will use the tape, so I'm going to put that in here. We have another set of forceps. There's scissors. Yeah. Dressing cover. And the safety pin, the elusive safety pin. Trying to get this out of here could be a real treat. So, I will tell you though, if you have a safety pin in here and it's in the very center or off on the far side, it sometimes can be difficult to get. However, if you reach in here, you can reach both hands in, right? You can reach both hands in and tip it up to get the safety pin to the side where you can reach it, okay? So, here we go. Because I don't want to touch my hand to the outside, right? I'm going to reach in. Woo, got it. We are not going to be using this safety pin, okay?
We still haven't figured out what the safety pin's for.
We have no idea. No, because here's the thing. We're going to be pouring our cleansing solution in there, or water, to irrigate the wound with. We're not really going to use it, but we're going to pour it. We're going to show you why. So, Dawn, or somebody would, could you film for her? Oh, I didn't rip the top fully off.
It's fine.
Rotate this around. You didn't see this. This is not, okay. There we go. Dawn, could you possibly pour my 0.9% normal saline into the container for me for irrigation? Will you check the expiration date and to make sure that you don't see any contaminants? And will you lip it first, please, before you pour it?
Yes. Do my hand hygiene. All right. So I have 0.9% normal saline. It is not expired.
Good.
There are no contaminants in here.
Okay.
Taking off the lid, upside down. Label goes in my palm. I'm going to lip it to wash away any contaminants. And then in a sterile fashion, pour it into the container.
The only part that can reach into the sterile field is what is underneath the lid, remember? So she has solution in there for me. Thank you very
Is
much.
that enough?
That should be plenty. Thank you. Okay.
Putting the lid back on, leaving it out so they can see that it's that solution.
So now I need to make sure that that is in my field of vision. So what I'm going to do is I'm actually going to move that closer to my wound that I need to clean because the doctor may want to irrigate with it. Okay? So in order to move it, can I grab the outside? No. How am I going to move it? The inside, right? You got it. So you're going to put your hands on the inside, transfer it this way. Okay?
Making sure that you don't transport it over your sterile
Yes.
field.
Notice how it came back this way, went this way. The other thing you need to think about is you will be doing wound care from here to here, and you don't want to reach over it. So you need to have it further, like far enough back where you're not going to be reaching over it when you're going from here to here. Okay? Notice where my hands have been this whole time. Out here, not up here or like this, because you might accidentally touch it. So out here. Okay? So the first thing I'm going to do is I'm going to go ahead and reach in and get my swab sticks because I'm going to go ahead and use those to clean the wound. To open your swab sticks. Oh, these are those nasty Betadine ones. This is going in the biohazard. Loosen this up like this. You're going to take your first swab stick, start in the center. Yep. And you're going to work your way out in what kind of fashion? Circular. Do you lift up?
No.
Do you start over?
No.
Do you swab back and forth?
No.
Perfect. So starting in the center, big thing with this is make sure your hand doesn't come down here and touch the patient's skin. Starting in the center, working your way out, and you're going all the way out, all the way underneath the edge here where that possible undermining is. One direction, don't lift up, don't start over. Then you're going to do that 2 more times. Start in the center, work your way out. And one last time. Start in the center, work your way out. When you go to put these in the garbage, just drop them. You don't want to put them into the garbage, just drop. Okay? Okay, now what I'm going to do is I'm going to pack the wound. We're going to pack the wound with one gauze that has been wetted with the normal saline. So I'm going to go ahead and reach in. Place that in my solution. And then in order to get this solution out, you really like to use one hand so that way both hands don't get wet and drip everywhere. So I'm going to go ahead and reach in. If you need to use both hands, notice I'm only reaching in and I'm not like this over top of it. Reaching in just with your fingertips. This hand's still out here. Then when I go to pack this wound, I have 2 pieces of gauze here because I have an extra one. When you go to pack this wound, be careful that what you're going to pack with doesn't drop down onto the patient's skin, okay? The only part that should have the packing on it is the wound. The nice healthy tissue on the outside should not be wet with the packing material, okay? So I'm going to very carefully go ahead and place this in the wound. And I'm going to slowly get out more packing. That way it's not dropping down onto the patient's normal skin. And you want to make sure it's packed. And you want to make sure you get underneath the edges. Okay, packing. Now we're going to go ahead and cover it with our ABD pad. And then once that is covered, then your sterile field is no longer needed because you're just going to be taping and like stabilizing that dressing. If you need to use scissors that are on your sterile field, you can. Then you would go ahead and tape your wound or your dressing. Not wound. Now, wound care can be very painful for patients, so oftentimes they will take a medication ahead of time to help with the pain of performing that wound care. And each office will have its own protocol on what that is. Questions? So you're done with your sterile field. You can go ahead and clean up, removing your gloves, and then doing your hand hygiene, and then cleaning your room per office protocol. Sound good? Perfect.